Hello guys, I would talk to you about a very important part as a continuation of the series. And we're going to deal with the clinical scenarios in your interview as part of the training. One of the very important frameworks is the SPIES framework. There are various interpretations of it, but I'm going to give you mine and I'm going to break it down. So let's just start by looking at the SPIES framework. So the SPIES framework is spelled that way. Yeah. So that's S, and S tend to mean summary, which means you summarize the clinical scenario that you've been given. Now, it could vary from interview to interview, but as summary, usually it's a good way to approach it. That's my preferred, way to approach it. The other interpretation you may see of S is situation, which is also an alternative. Yeah, so you may have a situation in the case, but my preferred is to try and summarize what the examiners have told you. The next is the B1, the B part. The P part. And here is my preferred is priority, if you like. So that's priority is my preferred one. So what's the priority? What's your priority from the summary that you've made of the case? Yeah, so your priority would be, what do you want to do immediately, or how do you organize what's happening in your clinical situation to deal with this? Now, some other interpretation of this is problems. So in some scenarios, the examiners may ask you, could you tell us the problems in the case? So you want to list the problems. So depending on the scenario. I think the most complex one is the I. And I'll talk about the I in details shortly. But the I means intervention. And basically, what would you do? All of the scenarios you would encounter would fall into one of any two scenarios. It could be, in most cases, an urgent, emergent, or if you like, emergency scenario. Yeah. Occasionally, depending on the grade, it's a more cool scenario. So more, if you like, non-urgent scenario, clinic type of scenario. I'll explain intervention in a lot of more details shortly. Then you go to the next one, which is E, escalation. Now, in escalation, what you need to do is you want to escalate to other clinical members of the team. So depending on your grade, so if you are SHO, you want to escalate to your registrar. If you are a registrar, you want to escalate to the consultant, both within your firm and outside your firm. This is where you make referrals to other team, medical team, surgical team, radiology, and so on and so forth. Hematology. Excuse me. So escalation. Then the final part of the SPIES is support. What support do you need to manage the case? So think about it this way: clinical, non-clinical. Clinical support, of course, you need nursing staff. Yeah. You may need also support from the other members of the team. So the F1, F2, if you are a registrar SHO, the advanced nurse practitioner, people like that. Then you also need the bed managers if you are admitting the patient, theater managers if you are booking a case. So this, again, depending on the case, you may have theater come here. So this is a broad overview of the SPIES. So remember, a summary or summarize the case or situation, then priority or problems, then you have intervention, and intervention could be urgent, emergent, or emergency. Then you have non-urgent, then you have escalation, registrar, consultant, referrals, radiology, hematology. You have support, nursing staff, F1, F2, bed manager, as well as theater manager. So this is your SPIES framework and overview.